The period from September 2023 to August 2024 has been recognized as one of the hottest on record. Heat can warm ocean temperatures. Warmer temperatures can contribute to increased potential for dramatic hurricanes and tropical storms. Increased rainfall increases the likelihood of an abundance of disease vectors such as mosquitoes, and changing weather patterns can also create drought conditions leading to wildfires, heavy smoke, and air pollution. In this context, many people have been thinking about the intersection of climate change and public health. Today on the CommonHealth Live, Dr. John Balbus, Director of the Office of Climate Change and Health Equity at the U.S. Department of Health and Human Services, will speak about the intersection, about new research regarding climate change and health, and the role that the U.S. government is playing in working to mitigate the impacts of climate change on human health today and into the future.
This is the Common Health from the CSIS Bipartisan Alliance for Global Health Security, engaging senior leaders on questions of how to address our common health security challenges in this post-COVID moment.
Hello and welcome to the CommonHealth Live. I'm Katherine Bliss with the CSIS Global Health Policy Center. It's my pleasure to speak today with Dr. John Balbus, Director of the Office of Climate Change and Health Equity at HHS. John is a physician and public health professional with several decades of experience working at the intersection of health and climate change. He's done this both as a policymaker and a researcher in federal government and academia. And we'll talk today about the ways in which climate variability affects human health, what's important to keep in mind when communicating with the public about the links between climate and health, and the steps the U.S. government is taking to mitigate the risks to the population's health from climate change. John, welcome to the Common Health.
Thanks for having me today.
So I want to start with the new office that you direct, the Office of Climate Change and Health Equity. The U.S. government has had various entities or initiatives related to health and climate change since at least the early 2000s, particularly focused on research. But the Office of Climate Change and Health Equity was set up in 2021, if I'm not mistaken, after the executive order, really, I think, on tackling the climate crisis at home and abroad.
Exactly.
And so I wanted to ask you to say a bit about the origins of the office, the links to the environmental justice agenda in particular, and why health equity is part of the name.
So as you say, it was part of the Biden administration's suite of executive orders to both address the climate crisis, but also health equity and environmental justice. And our office was created with a mandate to protect the health of everybody in the United States, especially those most vulnerable. So the primary mandate was a health equity mandate. And that's because the stressors of climate change are cumulative to the other stressors that a lot of communities in our country face. The same communities that experience the brunt of COVID because of all of the social factors there, occupational factors, residential factors, the same communities that bear the brunt of environmental exposures like air pollution are the exact, many places the same places with the worst exposure to heat and urban heat islands, or most likely to experience severe flooding, as we see, in some of the hurricanes in the Gulf Coast. So these things all relate together. Climate change, is a cross-cutting factor that affects the lives of people who are being affected by other things and thinking about other things at the same time.
So these challenges are really compounded, particularly for some of the most vulnerable sectors of society. But, just in talking there, you talked about air pollution, you talked about, I don't know if you talked about sea level rise, but you talked about extreme heat and weather. And so, climate change and climate change is a big topic. Health is a big topic. When you bring the two together, you've got a lot of different issues. And then if we start bringing health security and national security into the mix, there's a lot to talk about. to emerging infectious diseases or waterborne disease or health effects of pollution. When you're looking at the issues of the climate change and health equity agenda, how does your office, what are the specific priorities of your office, and how do you decide what's included and what's not?
So from our office's perspective, we came into being in 2021. We are a very small office. We're a new office in the midst of a department that, as you say, has always had some elements of it working on climate change, but most elements not working at all on it. I think it's very telling if you look at the climate adaptation plan or the climate action plan from 2021, at the start of the Biden administration, and you look at the priorities for HHS, one priority is to grow the existing offices, the climate and health program at CDC and the climate and health work at NIH, mostly led by NIEHS, where I was. And then the next thing was, and then everybody else. And it was blank. There was not, just we're going to do something with everybody else. And that's where our office stepped in. So the first part of what we were trying to do was recognizing that HHS, is the biggest grant-making organization in the world, is the safety net for so much of our country, not just on the health side, but also on the human services side. It was, and yet, the prevailing attitude in healthcare. As a physician, I can say this, until very, very recently was, climate change is an environmental issue. Climate change is a future issue. I have a patient, I'm seeing right now. I can't worry about what's going to happen 10, 15, 30, 100 years from now. And so there was a lot to kind of get people on board in all of these different departments. So a lot of our initial goal in trying to serve the most vulnerable populations was actually to take the, hundreds of millions and billions of dollars that are targeted to things like energy insecurity, that are targeted to water insecurity, that are, supporting the healthcare systems for low-income communities, and make sure that they were climate smart, make sure that they were understanding where the stresses are coming and where they're kind of exceeding capacity. So that was a part of what we were doing. The other part was, while our stated mandate was to protect the people and the public health, we very quickly took on a very ambitious goal, which was also to take on the actual health sector of the United States, public and private, and to move it towards being climate smart, which means, having it address its own contribution to climate change. In the United States, it's estimated that the health sector contributes 8.5% of the nation's total greenhouse gas through its activities. That's a huge amount. That's, globally it's about 4 to 5%. It's more than the airline industry. So, with an ethical duty to do no harm, with an ethical duty to protect the health of people, there's a big role for the health sector there. And then, of course, as we're seeing, play out, again and again in this country, when health systems go down, people are harmed. And, when the safety net health system goes down, or the urban hospitals, or, really, any major hospital, the people who suffer the most are low-income people who have trouble moving to another place or trouble getting the care they need. So we very soon took on the need to address the vulnerabilities of the health system as well, especially the safety net health systems.
So it sounds like, you've had a couple of really big wins. I mean, one is just raising awareness across HHS. All the different agencies may have been doing a little bit here and there, but not necessarily in a coordinated way. But now it's much more visible through the work that you've been doing, but also really getting that agenda with respect to the health, as you said, the mitigation, side from the health sector, its own contributions to climate change, kind of raising awareness of that, to very important things in a fairly short period of time. What would you say has been one of the biggest challenges that you've faced in really kind of trying to raise the visibility of these issues within the agency and more broadly?
So, within the agency, it really, first of all, let me start by saying what has been gratifying and remarkable has been the support that we've received. We convene a working group that has all of the divisions of HHS in it. After COP 28 last year in December, we published a supplement to that climate adaptation strategy that I had commented on, where that goal number 2 that was blank now had 50 accomplishments and 40 accomplishments and another 50 commitments for the coming year from every single operating division of HHS. So, there has been a lot of support. The challenge is that first challenge I have to say is a complete absence of funding for this work. Our office has not received congressional appropriation despite being in the president's budget, and the Inflation Reduction Act, which has been historic and the most important piece of climate legislation ever and is doing amazing things. And we're working very closely, we can talk about that more, with the agencies that receive funding from it. But there was no climate funding for HHS in that, for any of the other divisions. When budgets drive staffing, they drive focus, they drive prioritization, they drive accountability. So lacking that has been a challenge. The other challenge is just overcoming what's a pretty long-standing attitude among people working on health, that climate change is an environmental issue, not a health issue.
Well, yeah, I mean, that's one of the big challenges I've always seen with environmental health, is that you have the environmental impacts on the health sector. The response comes from the health sector, but the view is that, well, it's the water sector that needs to deal with it, or it's the industry that needs to reduce pollution. And so the causes, are elsewhere. At the same time, I mean, even when we're talking about looking at climate and health, I mean, when you're talking about forecasting or gathering data or anticipating the conditions that might lead to impacts on human health, if you're looking at remote sensing or analyzing satellite data or something, again, that's probably coming from a different agency. You talked about the Inflation Reduction Act and some of the agencies that have had funding to deal with climate issues. And so I did want to ask you how, when there's this kind of tension between cause and effect within the health sector, between kind of the cause, the perhaps climate-related cause, and then the impacts on health, and different agencies are all at the table. How do you get the agencies to work together, or what are some of the incentives that you found to be most useful to kind of build that collaboration?
So there have, first of all, just been several different platforms for interagency collaboration that are working very well. Certainly on the data collection on the science side, like you were talking about, the development of prediction tools and those kinds of things. The collaboration within the Global Change Research Program, has been very strong. You mentioned that I, used to co-chair our working group on climate change and health. There is a long-standing collaboration among the agencies that generate the data, NASA and NOAA, EPA, and organizations like the CDC and NIH. With the Inflation Reduction Act, there has been a huge challenge because it's such a big bill. There's so many new programs, so much work to be done to stand them up and to be able to get the money spent effectively, that it's sometimes hard to be able to get the attention for something like the health sector, which wasn't written in. But excuse me, we found the agencies to be very, very receptive, and we have had a number of initiatives. We had something called our catalytic program, where we had kind of a sprint. We had over 4 webinars every 2 weeks for a 7-week period, where we brought in all the agencies, and all the agency staff came and spoke to the health sector to give them instructions. The things that have worked have been shared mission. They've been leadership from the highest level, and the creation of platforms for this kind of collaboration. In this administration, it's been the Climate Task Force on down.
Well, and as you said, some of these research programs have been around for several decades. People know each other. It sounds like, there's a certain level of, an extended network within the agencies that can share that vision and that mission going forward. So 2024 is one of the hottest, if not the hottest year on record. We've also seen a number of different climate-related health impacts just here in the U.S. Dengue in the Caribbean and Puerto Rico, extreme heat waves on the East Coast in June and July, Hurricanes Helene and Milton just recently wiping out access to healthcare for thousands of people. And obviously a great deal of news coverage recently as well about the plant Baxter International in Western North Carolina that provided IV solution to so many hospitals around the country. So you talked a little bit about the interaction with the public and kind of awareness of the climate and health issues. But I wanted to ask you to reflect a little bit on how, just the events of the past year, how you see, how that has shaped the American public's understanding around climate and health, and if you feel like there's been kind of a shift in consciousness and kind of greater awareness over this period.
So, it's kind of, first of all, I'll have to confess, I run an office of just a few people who are working on actual policy and programming, and we don't do the surveys. We don't have the means of really assessing the public's, short-term changes in the public's attitudes. What has happened in the last 3 years, because of course 2024 has not been an unusual year. 2023 was the hottest year on record before 2024 became the hottest year on record. 2021 had opened up as soon as I came over to take the position to try to start up this Office of Climate Change and Health Equity. We lost hundreds of people in the Northwest in a completely unprecedented heat event in 2021. So, and if you look at heat-related mortality, it's tripled since the average of the first 2 decades of this century. If you look at, no matter where you look, if you look at billion-dollar disasters, we keep changing the y-axis because we have ever more, a greater number of billion-dollar disasters than we've had before. I think of that all of these things are moving, are moving health professionals and the health sector. So, the biggest change that's really happened in these 3 years, and our office is, both a reflection of it and also, I hope, a driving force within the government. But it's also happened, through the work of the WHO and through the UN Framework Convention on Climate Change, which had its very first health ministers meeting at COP28. We're seeing in an unprecedented way the health sector take on this issue of climate change, and I do think that it's because they are seeing the reality in their patients, in their facilities, in their communities, in a way. Our nation has become a place where people get their information from very different places now, and kind of very separate places. And I'm not sure. I think that has an impact on how open people are to changing long held positions.
Well, so during COVID-19, one of the issues that we really saw scale up quite a bit was misinformation. In that context, a lot of it was centered around vaccines, but that was within a context of skepticism around science and around expertise. And, there was a lot of misinformation that's circulated on all these, on the variety of different kinds of channels where people do receive their news, as you just said. Certainly there's climate denialism on the one hand and mistrust of the health system on the other. And, on top of that, as you mentioned at the beginning, we have some of the most vulnerable communities in the country really at the center of a lot of these natural disasters. And I know that the Surgeon General and many others have really focused on the crisis of misinformation in this country and the importance of rebuilding confidence and trust. And just wanted to ask you to say, a little bit from the perspective of the office, about some of the promising steps you see that can be taken to kind of address some of the skepticism around the science of climate and health and where steps can be taken to improve health equity in that context.
So certainly the impact that the misinformation and communication from various sectors around the COVID pandemic that led to health threats to public health officials and states is an extremely disturbing development. Because there has always been a sense, or always, for the last 50, 70 years anyway, a sense that health professionals are among the most trusted people in society, and that if a health professional took an opinion, that there was just an assumption that it was not self-interest, that it was actually the interest of the people that they cared for. So to see that be attacked is very alarming, because if you, I've been working on climate change for over 30 years, and in the climate community, there was always this sense, well, when we get the health sector on board, when we get doctors talking about this, then people will believe, then people will trust. I think that assumption has truth to it, but I think it's also perhaps not as reliable as it was in the past. And then when you see things like weather forecasters being accused of actually manipulating the weather to divert horrible, tragic storms that they actually experience devastating grief about, even though, because they're the ones that are trying to save lives, they're the ones that are serving the public, and when they get accused of actually manipulating the weather, that's a sorry state of understanding in our country. Mm-hmm. So, I think the paths out of it are, integrity and commitment to truth and commitment to facts and commitment to science, to reliance on trusted messengers of various sorts, whether those are religious figures, whether those are health figures, and ultimately quality education in this country, because if people don't understand science when they come out of basic public education, it's going to be really hard to make arguments about complex scientific things.
So part of what is needed then is really bringing awareness and education about climate and health issues from elementary school on up, so that people
Absolutely.
Can really grapple with the changing science and think about some of that. One thing that you've mentioned a couple of times is the kind of changing tack a little bit here, but around the issue of the role of the health sector in not just raising awareness and educating about the challenges that a changing climate poses for health, but just the contributions, the emissions and contributions that the manufacturing and service provision contribute to overall greenhouse gas emissions. Could you say a little bit about the potential for public-private partnerships to kind of begin to address some of these challenges, and what do you see, over the next several years as kind of the most promising ways for the health sector to really kind of commit and move forward?
So absolutely, and we're seeing these public-private partnerships take hold, all around the world, really. If you look at where the emissions come from, one of the challenges is they come from just a whole array of different sources. So there's many things that need to be done. About 20% is coming from energy use in the buildings. So, that is where people are focusing now. They're focusing on renewable energy supplies. And, one of the key points there that has to be made is that, virtually all of the first steps that get taken to reduce the emissions of a healthcare facility actually save the facility money, actually enhance its resilience, and ultimately lead to higher quality of care. So, there will be a narrative that, well, why should we make hospitals do this? They need to take care of patients. It's only going to hurt people if we make them think about energy sources. But if you will see the stories come out from, they came out after Superstorm Sandy in New York. They're coming out from North Carolina. You're going to see this in Florida, where there's a lot of renewable energy sources. These, when healthcare facilities are able to have their own microgrids and battery backups, and in most cases a solar system, they often sustain these devastating storms and keep the power on and keep the patients inside the walls. Oh, and by the way, their energy costs go down, and they have an investment that's saving them money year after year. So it's important to make the connection between reducing emissions and actually enhancing resilience and lowering the operating costs and improving outcomes. But then there's the whole supply chain, which is 60, 70%. And we say supply chain, it's technically scope 3, so it's supply chain, it's the food that gets served is substantial as well, and many other things. That's where that public-private partnership comes in. We're seeing some leadership in some of the pharmaceutical companies that are looking at their energy supplies and ensuring that they are carbon neutral or renewable energy sources. And some of the big ones are, investing in renewable energy for their supply chain, so it's going all the way up the value chain. So in some ways, we're seeing, these partnerships. These entities are, partnering with the federal government in different ways. The Department of Energy is funding a consortium that's doing renewable energy and microgrids for community health centers, the safety net, which are in the low-income communities in the Southeast. And then of course the National Academy of Medicine has a new initiative on decarbonizing the health sector in the United States, which brings in the private sector along with my boss, the Assistant Secretary for Health, Admiral Levine, is a co-chair of that. So there's a lot of ways things are moving, but the ultimate solution for some of those health sector emissions are really economy-wide solutions for major industrial sectors.
So it can, making especially the hospitals and provision of care more energy efficient can save money, improve quality of care, and just ensure that there is access to care in
Exactly.
Regions that particularly experience these challenges. But it sounds like, at least with the supply chain and manufacturing, it kind of requires industry-wide commitment, right? That if just one takes the step to go ahead and do it, that's great, but they may all need to kind of band together to make kind of joint commitments to work in this way.
Ultimately, what we're seeing also are more and more countries, setting procurement standards for their national health systems. The United Kingdom, or England actually, the National Health System of England was the first to really step out and to send a clear signal to its suppliers that they were going to be requiring, greenhouse gas reporting, and ultimately steps being taken to lower their suppliers' greenhouse gas emissions if they wanted to do business with NHS England.
And then, so let's say the UK does that. I mean, does it then prompt other regulatory authorities in other countries to do the same? I mean, is there pressure then on them to kind of adopt the same standards?
It's at least a leadership example, whether that's pressure or not. We're seeing it. We're seeing, there has been a proposed a proposed amendment to the federal acquisitions regulations that would do something very similar for all federal contractors. And so that would include the federal health systems. So our office convenes the federal health systems as part of our commitment to working on sustainability and resilience of all the health sector in the United States. About 15% of it is in the federal systems, mostly in the VA and the Department of Defense. And so they're big purchasers as well. So our office has been working with NHS England to create, an informal, to find other partners, in other mostly high-income countries that are looking at doing the same thing with procurement standards.
Okay. And then by, really kind of showing that example through bulk procurement and really kind of making that economic impact, then that may, I guess the idea is that would then lead other elements of the health sector to follow suit.
Exactly, and we're actually seeing that as well. So, in the space of global health, we're seeing, first of all, we're seeing some action within the U.S. government from PEPFAR and rollback malaria to be looking at supply chain issues from a sustainability standpoint as well as a resilience standpoint. Looking at onshoring, looking at reducing distances, looking at lower emitting, means of transportation, those kinds of things. But also the Global Fund is looking very seriously in all of their purchasing. So it's starting to take hold. This is what's happened in the last 3 years, is that entities like the Global Fund, that could have said, well, climate change, we worry about TB, that's not a climate change issue, right? But they're recognizing that climate change, in fact, affects everybody that they're trying to help. It affects the way they do business, and ultimately that they have a responsibility to help be part of the solution.
Well, and if they lose, if their warehouse is flooded or, destroyed because of a storm, then that becomes very expensive.
Exactly.
For them and for all the countries that support them as well. So thinking about these global issues, I know your office is largely focused on domestic challenges, but obviously climate and health are issues that have been taken up internationally. As you said, last year at COP28 was the first year there was really a health day within the climate change discussions. There's going to be another one this year in Baku in Azerbaijan in just a month or so. I wanted to ask you to say a little bit about how you see what's happened here in the United States, kind of the domestic agenda influencing how the United States engages internationally on some of the issues. You've already talked a little bit about PEPFAR and PMI and some of the supply chain and procurement issues. But, are there lessons from what we've seen here in the United States that can be shared with other countries? And are there examples from overseas that you've talked about the NHS example, but, are there others that would be helpful to bring back here to the domestic agenda?
So first quick answer is that there are absolutely lessons to be learned from many other places in the world, especially low-income settings that are, having to get by with very few resources or dealing with, a lack of any energy, with a lack of any clean water. We need to be addressing those kinds of problems in a way that's cost-effective and saves money and, isn't wasteful. So there's a lot that we learn from what goes on in other countries. In terms of how our domestic work has an influence, I think it's hard to understate the leadership role of the United States in all diplomatic and international contexts. When I mentioned that we were given a mandate to work on to work on protecting the health of the most vulnerable people. But a month after that was COP26 in Glasgow. And we were invited to join the COP26 health program, which was the first. The United Kingdom was the presidency of COP26. And this was the first major effort to engage the actual health ministries around the world in climate change commitments. And so the fact that the United States did so early and publicly, I think had a big influence on other health ministries around the world saying, well, maybe we should sign on to this too. So that's just one example. The existence of our office, the work that we are doing, is mirrored and reflected by developments throughout the U.S. government. So, the Prepare initiative of President Biden, which is focused on financing and funding for climate change in general, started out without a whole lot of health in it, but the health content of that has been building up. USAID is doing a lot of work on protecting people from heat and convenings on related to heat stress and heat and workers, et cetera. Our Office of Global Affairs, is our diplomat within HHS, is our diplomatic arm that brings U.S. positions and support for these kinds of activities to everything from the World Health Organization, which has just set a new global program of work in which climate is number one of 6 priorities across all of WHO, to things like the G7 health ministries and the G20 health ministries, all of which are really starting to grapple with climate change and health. So, it happens in the diplomatic circles, it happens in the private sector, and it happens in government-to-government relationships, the bilateral relationships.
So your office has been around now about 3 years. The next COP is in a month or so, but I guess, we can be hopeful that health will be a part of the conversation for some time to come. But as you look ahead 5 to kind of 10 years into the future, what are your hopes for kind of where the U.S. will be in terms of the whether it's the Office of Climate Change and Health Equity, or kind of more broadly, like in terms of the key accomplishments around climate and health in kind of the 5 to 10 year period? What do you most want to see?
So we've made a lot of progress in these 3 years on ensuring that the mainstream activities of HHS are climate smart. And when that occurs, we probably won't need much of an Office of Climate Change and Health Equity. So, my 10-year plan is really to try to put us out of business. And, where we're seeing movement in, especially in the Center for Medicare and Medicaid Services, where, starting with their technical assistance programs, are starting to, explicitly have support for technical assistance on emergency preparedness and extreme weather resilience. We have the new team model for this from the Center for Medicare and Medicaid Innovation, where they are, for the first time, having a voluntary pilot for health facilities to start reporting on their greenhouse gases, and collaborating with the CMS on ways to lower their emissions and reduce costs. That just got announced and will be ramping up over the next few years. So, if this trend continues, and the idea that healthcare facilities around the country actually fare better when they have microgrids and they're controlling their energy supply, they're controlling their energy costs and lowering them. Ultimately that leads to everybody doing it, and that changes, processes of certification. So we've seen the Joint Commission starting with a sustainability, certification, not a condition of accreditation, but things will move in that direction. Things moving in that direction, so that it's a level playing field, and it just becomes a recognition that everybody needs to do this for us to get to the safe place we need to be in the climate crisis. That's the 10-year vision.
So hopefully you won't have an office anymore, but that's because it will have been embedded in all the different aspects of health, domestic and global, and people will have adopted these practices that you're working very hard for the health sector to embrace, because it's both cost effective and really leads to quality health outcomes in the longer term.
Exactly.
Well, it sounds like a good 10-year vision to get behind. John Balbus, thank you very much for taking the time to talk with me about a very timely, ambitious research and policy agenda on both the domestic and international implications of climate change and health. And thanks very much for joining me today. And thank you to our audience for joining as well.
Great. Thanks for having me, and thanks for opening the discussion on this topic.
Thank you.